Ovarian cancer is the most lethal gynecologic malignancy worldwide. With an estimated 150,000 deaths per year, ovarian cancer is the fifth leading cause of cancer-related deaths in women. Due to a lack of early detection methods and non-specific clinical signs, such as bloating, back pain, and nausea, most women are diagnosed with advanced disease. Even with radical treatment, many women will relapse and die. We desperately need new therapies to treat ovarian cancer. In the last 20 years, immunotherapy has revolutionized the world of cancer treatment. There are two major arms of immunotherapy. The one most of us are probably familiar with is cellular therapies such as CAR T-cell therapy. In addition, therapeutic antibodies have become one of the fastest growing classes of tumor targeting drug. CAR T-cells and antibodies only recognize certain proteins on the cancer cells, so this can allow the tumor cells to escape the therapy, and a lot of patients will develop resistance. These therapies can also have some serious complications, including complete failure of the treatment or even death. Immunotherapy is a growing area for potential new therapies. Our lab is interested in natural killer cell immunotherapies. Natural killer cells, or NK cells, as the name implies, are really good at killing cells such as cancer cells and virally infected cells. The main mechanism that NK cells use to kill is a process called antibody-dependent cell-mediated cytotoxicity, or ADCC, and many therapeutic antibodies use ADCC as a mechanism of action. ADCC is mediated by an Fc receptor called CD16A. When CD16A binds to an antibody on a cancer cell, the NK cell releases chemicals such as perforin and granzyme to cause the tumor cell to die. However, CD16A is a low affinity Fc receptor and is rapidly downregulated when it's activated. This may be one reason for antibody therapy failure in certain cancer patients. CD16 is part of a larger family of Fc receptors, and all Fc receptors are low affinity except for one. I like to think of their low affinity for antibodies as a weak handshake. CD64 is the only high affinity Fc receptor, and here we can think of CD64's affinity for antibodies as a really strong handshake with somebody who just won't let go. We think that increasing the ability for a natural killer cell to attach to antibodies might result in a better cellular therapy for treating cancer. However, CD64 is not expressed by natural killer cells, so to test our hypothesis, we engineered a recombinant Fc receptor containing the extracellular region of CD64 and the transmembrane and intracellular regions of CD16A to retain normal signaling in the NK cell. In our cell culture studies, we were able to show that NK cells with CD64-16 effectively killed ovarian cancer tumor cells when combined with trastuzumab, a therapeutic antibody for HER2-positive cancers. We've recently moved on to studies in mice, and in a mouse model of metastatic ovarian cancer, we've seen mice treated with our NK cells and trastuzumab combination therapy living much longer than animals that weren't treated or animals that were treated with NK cells alone. While future studies are still needed, we are hopeful that natural killer cells expressing CD64-16 will be a safe and effective treatment for ovarian cancer in the future.